is an amino acid that is needed in order for serotonin to be developed in the brain. And as we know, serotonin is one of those neurotransmitters that's affected by some of the medicines that are given, such as Zoloft, Prozac, and Paxil. Tryptophan can be found in each one of these foods: almonds, avocados, these are raw pumpkin seeds, and black-eyed peas. All of these are high in tryptophan. And I can give you case story after case story of people with whom I worked that I raised the intake of these foods, asked them to take them in more, and they started to see a difference in their depression. I remember a young lady that I worked with who started eating more of these, and she came into me one day and just plopped down on my desk and says, "Dr. Parks, I feel the best that I have felt even before I was depressed." And I knew that something was happening there with her foods. Then we have omega-3. If you look up here, you'll see flax seeds, walnuts, and green leafy vegetables. These are all high in omega-3, and omega-3 is something that our brain does not naturally produce. We have to eat foods in order to get omega-3. And I remember with many of my patients, I would have them taking 2 to 3 tablespoons of ground flax seeds every day, and it's something as small as that, they would report tremendous results. I remember a lady who was crying constantly, always crying, and I had her go on these. She didn't want to use medication. She came in to see me. I said, "I want you to start taking 2 to 3 tablespoons of ground flax seeds every day." And she reported to me after about 2 or 3 weeks that her crying actually stopped. So it did wonders for her in terms of just helping her cope better. In this study by the American Journal of Psychiatry, or in the American Journal of Psychiatry, it says treatment with omega-3 fatty acid appears to benefit children suffering from clinical depression. So there is now research that's starting to show the helpfulness of omega-3, and I used to use that a lot with my clients. And I say used to. At the current time, I'm no longer in private practice because I'm working with my husband as we go around and lecture and go to homes and do things. But in the past, when I was doing this more frequently, omega-3 was a great help. Now, some people may say, "I've heard fish is really high in omega-3, so I can eat more fish, can I not?" And you can, that is true, but there's some fishiness about fish. And I want to share some things with you in a wonderful book written by a physician called Foods and Their Healing Power. And he just presents a lot of good information about foods and how it can help us. And in here, he talks about fish. He gives both the positive and the negative aspects of fish. And I'll just read some things to you and I'll let you make your decision. Fish is, of course, good because it's easily digested, it's raised in nature, it's heart healthy, but there are a lot of drawbacks to fish, and I just want to name some for you. It lacks in certain nutrients. Fish does not contain vitamin C, carbohydrates, or fiber. It contains little calcium. Another thing about fish, since fish contains no vegetable fiber, believe it or not, it's often constipated. And then with allergies, fish is the most allergenic of all foods. My husband and I have actually worked with people who are allergic to many different things, and once we asked them to get off of fish and a couple of other things, you'd be surprised what happened to those allergies. Fish is high in uric acid, which can cause kidney stones and other problems. And then there's also research starting to show fish intake being related to cancer. So you might get omega-3 from fish, and if people insist on doing that, I admonish them to eat things such as salmon. But I wanted to just share that with you to just let you know there's also some drawbacks to eating fish as well for omega-3. Another cause of depression, we went over this earlier, is low folate levels. Folate's also known as folic acid. And people who are not eating a lot of healthy grains or oranges or certain kind of beans can also have problems with depression. And what's interesting, one study found that people who had low folate levels also didn't respond to some of the antidepressant drugs. And when they raised their folic acid levels, they responded to the drugs better. So there's something with this folic acid that we need to keep in mind. It's a B vitamin, and B vitamins are very good for the nervous system. And then carbohydrates. Sometimes we're not eating the right kind of carbohydrates. If you look at this picture, you'll see Cheetos and a few other things. I think that's Cheetos or some kind of chips. good, very high in carbohydrates, but we don't want you eating these kind of carbohydrates. Actually, when people used to come into my office and they tell me they're eating a lot of these foods, automatically I think to myself their serotonin levels are low, because this usually is an indication of a low serotonin level. So I'd have them increase things such as some of these vegetables that's high in good carbohydrates, or plain potatoes. Notice these are just plain potatoes, not French fries or baked potatoes loaded with sour cream and all of that, but potatoes themselves. Good carbohydrates, good for the brain, good for depression. So these are just some things that can help a lot with depression. And there are other foods. I mentioned almonds. Almonds are very good for the nervous system and other things. So we want to increase these foods. And I can give you case story after case story of people who were eating these foods and their depression levels went down. Now, this is not the case with everyone, but this is just one of the areas that we seek to attack when we're helping people with depression. And there is a food that is, we consider a total food. I want to read some things again from Foods and Their Healing Powers to you that talks about oats. Oats is a wonderful food. I don't know how many of you all like oats, but oats balances the nerves. And oat water, actually mixing the oats with water in a certain way, and it gives you the description of how to do that, has a stabilizing and invigorating effect on the nervous system. It is highly recommended in cases of insomnia, in cases of depression, fatigue, or mental exhaustion. So oats is considered a total food because it has all the B vitamins, and it has many other things that are good for the nervous system. And I thought I would share that with you. God has given us such wonderful foods that we can use to help us with depression. And I'm hoping that from this, if you are depressed or you know someone who is, that you will start to increase these foods. So this goes back, what I've just shared briefly goes back to what God told us in Genesis 1:29. And God said, "Behold, I have given you every herb bearing seed, which is upon the face of all the earth, and every tree in the which is the fruit of a tree yielding seed, to you it shall be for meat." When God gave us these foods, He didn't give it to us to restrict us. He knew what the end result will be. And some of the foods we talked about was included in this command that God gave to us, Adam and Eve, in the beginning. So if we increase the foods that He naturally gave to us, it would help us not only with depression, but many other illnesses. Another thing that depression is very helpful for is exercise. And in my book on treating depression naturally, I talk about why exercise is helpful. Exercise is something that more and more research is showing is helpful. Exercise reduces the levels of cortisol, a stress hormone. It reduces tension to muscles, which can induce a more relaxed state of being. And even in some cases, short walks, 10 to 15 minutes, can help reduce depression and improve mood. There's one case example I have in here of a woman who I couldn't get to change her diet or do anything else, but she would walk. And as she started to walk and started to feel better, then she was more willing to make some of the other lifestyle changes. And she told me that if she just missed one day of walking, just one day, she would notice her depression starting to raise again. So for her, just walking 20 to 20 minutes a day did wonders for her depression. And if you look at the literature, you'll see more and more science is showing that exercise is a very good thing for depression. In fact, I think there's one psychiatrist that prescribes exercise as opposed to Prozac for depression. Now, the problem with exercise, it's really hard to get people motivated. So we just work with them. When I've worked with them, I just say, if you could just start out 10 minutes a day and just increase that as time goes on. And usually that will get some people going. But others, you know, it's a little more difficult. Now, there's one exercise that I will say that is even more inclusive than walking. And some of you may know what that is. It is gardening. Listen to what this inspired author says again. And she says, "And for such exercises, there is nothing better than the cultivation of the soil. Let patients have flower beds to care for or work to do in the orchard or vegetable garden. As they are encouraged to leave their rooms and spend time in the open air, cultivating flowers or doing some other light, pleasant work," here's the key right here, "their attention will be diverted from themselves and their sufferings." That's very important, because sometimes people who are dealing with emotional problems, They're so focused on all the pain, emotional pain that they're experiencing, and if we can get them to engage in an activity that will take their minds away from themselves, we'll find that that will help with their healing. So walking is good, but if you could get some gardening in, that will be even better, or doing both for the depression. Let's move on. Another study compared symptoms of depression in active and